The phone rings, and it's a new potential patient looking for dentistry. What's the first question that they ask? 9 times out of 10, it's going to be, how much is that going to cost me? Now, as a practice owner, I'm sure you find this question to be a little frustrating because it often gives the impression that the patient is nothing more than a price shopper. But what if I told you that 90% of new patients that ask this question aren't actually price shoppers? Rather, they just don't know what else to ask. We've listened to thousands of calls here at RevUp Dental, and one thing that we've noticed receptionists consistently battle with is how to handle the price question. And we don't blame them. It's a hard one. If you've heard your staff struggling with this question and want to know how to help them overcome this hurdle, be sure to stick around to the end of the video to hear our solution. So these are what we typically hear are the 2 variations of how the call can go. Number 1, the receptionists are too reactive. This means when a potential patient calls in and the first question they ask is, do you provide dental implants and how much do they cost? The receptionist responds right away by saying something like, at our office, dental implants start at $3,000 per tooth. When receptionists are too reactive to the price question, it stops the conversation in its tracks, and it doesn't allow you to collect the potential patient's name and number. It doesn't allow you to ask any sort of discovery questions or build any sort of trust or rapport with that potential patient. It doesn't allow you the opportunity to talk about how amazing the dentist is, and it certainly doesn't give you the chance to book the patient in. The other variation of that call that we typically hear is number 2, we can't provide a price over the phone. This is when a potential patient is inquiring about price and the receptionist responds with something like, we can't actually give you the price over the phone. You'll need to come in and see the dentist first. This is my least favorite response because it makes the patient feel like you're hiding the cost and like you're going to scam them once they get into the door. If I was the patient, I wouldn't give this dental practice the time of day. So how does one actually tackle this situation? The first thing to understand is that not everybody is a price shopper, nor should they be labeled as cheap right off the bat. A lot of people ask what the price of something is going to be because they genuinely don't know what else to ask. They aren't educated on the subject and have no idea how to lead the conversation. This is why it's super important that the receptionist shifts the power of the conversation into their own hands and leads the conversation in the right direction. When a patient calls in and asks about the price, or really if they call in and ask about anything, you should always be using one simple sentence that will allow them to take control of the call, and that simple sentence is, I can definitely help you with that. Would you mind if I asked you a few questions first to better assist you? What that does with that one simple sentence, it allows the receptionist to take control of the conversation and steer the conversation while leading the call. After a sentence like that, you're able to ask the following questions, like, may I have your name and number in case we get disconnected? This will allow you to enter their information into the system so that if the patient does get off the call without booking, you can make sure that you can always follow up with them. You can also ask discovery questions like, what makes you think you need dental implants? When was the last time you visited the dentist? And are you in any kind of pain? Questions like this allow you to start to build a rapport and trust with the patient. When you take the time to get to know someone, you create a relationship outside of the price. You can then talk about the incredible experience that the patient would receive if they were to choose to come to your dental practice. So something could be said, something on the lines of, Dr. Smith has actually been placing dental implants for the last 20 years and has changed the lives of so many patients by giving them the smile that they've always dreamed of. He is an incredible dentist with fantastic attention to detail and will make you feel calm and at ease throughout the implant process. After you have done all of this, you could circle back to the price question by saying something like, with all that said, when would you be free to come by the clinic for a consultation? At this point, you have shifted the potential patient's initial question regarding the price out of their mind and have them solely focused on booking that appointment. Now, I can't stress enough, by asking discovery questions to learn more about your patient, to building a rapport to gain their trust, to selling the sizzle, aka reminding the patient why they should choose your practice, the receptionist has the complete control over the conversation and truly makes the booking process a lot easier for the patient, as all the questions they probably didn't think of prior to the call have already been answered. Hopefully by now you are equipped with all that you need to help your staff overcome a common obstacle in the industry. If you enjoyed this video, please be sure to hit the notification bell so you can stay up to date with our latest content. Also, be sure to leave us a comment and drop a like. And most importantly, please consider subscribing for more helpful tips to help grow your practice. Thank you so much and take care.